Hi. Hello. Thank you for having me. And, I'm just so inspired today by Mohita's talk and Ellie's talk and about what the great work in women in ophthalmology is going around the world. I think personally, the Singapore Society of Ophthalmology, we formed our women's chapter only this year, so we're a bit slower to the uptake, and it's very inspiring to see in the established chapters around the world what activities are going on, and we can really inspire ourselves to reach a more active state. My talk today is gratitude and give back to the community. So this picture that I have here, it's just a picture I put into AI when I put this sentence into the AI model to see what it comes up with. And it really gives you an idea, that giving back to the community can take many, many forms. So we really, as ophthalmologists, shouldn't restrict ourselves to only thinking it's only in one way, but we really should look at it in a really holistic perspective. I think one of some quotes that Helen Keller, who is a very famous advocate, is, these quotes that I've put up of her is especially special because not only is she born on my birthday, she's also born 100 years before me, so now you know my age. But this really speaks to me because dealing with a lot of disability and visual rehabilitation, Helen Keller was born both she wasn't born deaf and blind, but she acquired a disease that made her both deaf and blind. And through her adversity, she really managed to become a great voice, a writer, and an advocate, and not just for disability alone, but also in terms of civil rights, in terms of being a woman suffragette, where she was advocating for women voting, and she also did a lot for the disadvantaged communities and things like that. And this is really an inspiration that despite being having a significant disability, she was able to really achieve so much. And this, for me, was a very great inspiration. These quotes that I put up here that you can read yourself really give us a few principles. I think, when we look at the gratitude and the definition of gratitude, we want to look at the quality of being thankful. And this thankfulness and appreciation, we want to return the kindness. And in a way, we can summarize it as paying it forward. But this attitude of gratitude, I feel, is not just enough. It is what puts a spark to a fire, but in order for us to have the fire of want to give it back, we need to ask ourselves why we want to give back to the community and what fuels us to want to give back to the community. So I'm going to go through a bit of my own personal journey of why I wanted to give back, what we can do to give back, and how can I start giving back. So in a way, when we ask ourselves, why do we want to give back to the community? I think, we want to, as women, be representation and inspiration for the next generation. This is Professor Kyoko Ono Matsui, and I had a privilege to interview her in one of our young ophthalmology initiatives for APVRS, and to ask her why and what inspired her to do ophthalmology. And I think it was really fantastic, and her words was just that she just thought ophthalmology was such a beautiful specialty with all the photos you could look in the eye, and it just looked in a very aesthetically pleasing sense. And I just thought that was a really nice way to look at ophthalmology. And so I think every one of us, as we grow in our careers, have the responsibility to be that role model and that representation. And for those of us that are privileged enough to be on a more global and regional stage, I think this really can show people that it is possible to have a seat at the table, even as a woman or even as an Asian woman. And I think that is a true reason of why we want to give back to the community. I think empowerment through service. I will tell you a little bit more, but this is just a picture of me when I was a medical student fixing microscopes in the rural Philippines. This has always taught me that, by doing service in other places, we really do give our power back to communities to continue the work. And I think empathy and connection is what we all crave, and that's the reason why we do a lot to give back to the community, and of course, creating positive change. So how have I been doing that? I think I started always wanting to do a lot of this work, even as a medical student. And I increasingly, when I became an ophthalmologist, I was wondering which area in the Singapore National Eye Centre, which specialty I wanted to do. And I really always felt there was a great need to advocate for the visually impaired. As ophthalmologists, sometimes we neglect visual rehabilitation because it's not a very sexy money-making field, but it's very important. And when I chose my subspecialty interest, I chose it because I wanted to make more impact in the visually impaired world, and hence why I'm a medical retina doctor. And I think through the journey I had building a team of multidisciplinary people like low vision optometrists, occupational therapists, and social workers, we went together to train. And us as like-minded individuals, you can see in the photo in the middle there, we really managed to bring together a lot of initiatives, which included, giving digital technology training for the visually impaired. We incorporated a lot of sports like Paralympic swimming, and we are like the main classifiers for all the para sports in Singapore for the visually impaired. And as a result, we also get our staff to go and support a lot of the international events. I've also been privileged to be the Vice President of the Blind Association in Singapore, and this is one of my good friends, and we were on the news and Channel News Asia, and we were both talking about how visual impairment should not stop you from participating in sports, and we've become many good friends over the years. And so even locally, it was very inspiring that we were able to do so much, and we also were able to see in the second one find communities in Singapore that were very underprivileged. Even though Singapore is nice and shiny and you come there and you see all our nice tourist attractions, we do have pockets of society that also need help. And I think that taught us a lot on the barriers of healthcare delivery even within Singapore. And of course, serving in local societies, as I mentioned, the women's chapter is started. I also am the treasurer of the Singapore Society of Ophthalmology, and I think this is a really good way to be active locally and to give back to the community there. As my career grew, I was able to give back more regionally. So I started teaching and I started being involved in a lot more Asia Pacific conferences and also in societies. I also became the director of Global Eye Health, and we started doing a lot of outreach work in other countries, which included Laos and in Myanmar. I think the most inspirational thing is my journey started when I was a medical student. I told you I went to the south of Philippines to fix ophthalmic microscopes, and you can see the first article that I wrote on the right up there is really the article that got me into ophthalmology. So and then through my career, I think training international fellows, them going back to see how their career have progressed, has really been my inspiration to keep doing this. I think in Nepal, we had a great collaborative meeting there, and I'm very happy to report that my fellow, who's my Burmese fellow, has just completed her APAO LDP project in implementing AI for diabetic retinopathy screening in Myanmar. So regionally, also, there are many opportunities, and I think as you become more influential, this is the way you can give back. And of course, globally, being a panelist, being a speaker in the global stage, and also even influencing things like we became a WHO collaborating center and going to WHO meetings, and now even influencing policy and policymakers. This is a very exciting way to give back globally. So I will just end with some ways you can start to give back. Of course, you have to be authentic, know your strengths, and challenge yourself. I always think the team is what makes this most special, finding like-minded people to form lasting connections. I work very closely with a lot of young women ophthalmologists, and we really are quite passionate about our work in the region. And also read widely, think out of the box, and seek new experiences. Work hard, persevere, but also play hard and be mindful of impact and sustainability in all the programs. So with that, I thank you very much for giving me this opportunity to share, and I hope it's been helpful. Thank you very much.
Thank you so much, Dr. Tan.